we're going to talk about articulations. And when I say articulation, it is synonymous with joint. It's when two bones are meeting and articulating together. So when I say joint or articulation, I mean the same thing. So in this chapter, we talk about how joints can be classified as differently. But for this book, we're going to classify them by movement. So we have immovable, slightly movable, and freely movable. Freely movable joints are also synovial joints, and those are the joints we are going to hone in on in this class because those are the joints that are in our peripheral, in our extremities. They're called our peripheral joints. Those are the ones that allow us to move and be functional. So inherently, there is some instability and risk for injury for those versus the immovable or slightly immovable joints. So when we talk about synovial joints, there are 6 types in the body, and it is important to know these 6 types and where they can be found in the body. So we have our ball and socket, our condyloid, our gliding joints, our hinge joints, our pivot, and our saddle. So for a lot of these diagrams that we're going to go over when we're learning kind of the contents and the stability, we're going to be referring to the knee because it is a simple hinge joint. The elbow is also a hinge joint, but only where the olecranon goes over the humerus. And otherwise, there's a pivot joint too. So we're going to stick with the knee, and it's easier to kind of just understand. So in this video, we're just going to talk about the joint anatomy so you can understand that every synovial joint has the same contents. So first, we're going to start with it has a capsule. It's almost like a balloon encompassing the joint, keeping it safe, and also nourishing it and keeping it healthy with the synovial fluid. So there's a synovial capsule, the membrane, the lining there that secretes synovial fluid, which is a yellowish straw color fluid that stays inside. So if you ever like your knee blows up and you drain it to see what it is, synovial fluid could be in there and that would be yellowish, and that's fine. If it's red, it means that you have a structure like an ACL that tore and it's bleeding and it caused that big effusion. So back to the anatomy, you have your capsule, your lining, and your synovial fluid inside that nourishes the articular cartilage and the fibrocartilage and all the structures inside. And then we have articular cartilage and fibrocartilage. As we talked about, cartilage is very strong. It's designed to cushion and to allow smooth gliding surfaces. So articular cartilage is at the end of bones, and it's a really glistening, smooth white surface that goes on the outside of bones to allow that smooth surface. Over time, naturally, it will start to decrease in hydration, decrease with the amount of nourishment it's getting from the synovial fluid, and the blood supply also starts to weaken, and then the bone starts to get brittle and starts chipping away, and we start getting osteoarthritis. That's the natural progression of life as we get older, but you can get early osteoarthritis when you have injuries, especially injuries that are not intervened on appropriately, that basically gets you back to that pre-injury joint stability status. And when we have that, like ACLs that return too early, you get early. They've been able to prove that a lot of like NCAA athletes that had ACL tears that returned way too early had early osteoarthritis, and not just in the knee, but lots of other joints. So it's always important to make sure that we're returning a joint back to its normal pre-injury status when it comes to healing and joint stability as well. And that means neuromuscular wise, how it's communicating with the brain. All of that is important so that we can keep that articular cartilage really healthy. It doesn't heal, it doesn't repair itself, so it will need surgery, and it's just important to kind of maintain that as much as we can. Just beneath that articular cartilage is this gray area right here, which is the subchondral bone. It's that transition to the trabecular bone, and it's made of cartilage and then slowly transitioning to bone, and it's very spongy as well. And then we have fibrocartilage. Fibrocartilage is different from articular cartilage because it's not lining the bones, but it's like discs that cushion in between bones. It can also deepen sockets and create more stability. So for the knee, it's called the meniscus. And the meniscus are 2 cushiony discs that sit between the tibia and the femur, and they allow that socket to basically create a suction cup with the femoral head sitting on there and deepen the socket a little bit and create more stability. A similar thing in the shoulder with the glenoid, it deepens the socket and provides more stability. So we will learn more about that as we go joint by joint, how that fibrocartilage plays a role in that. In the spine, they're in between each intervertebral disc, or between each vertebrae, and they're called intervertebral discs. And they actually cushion and allow for kind of that absorption of force going through the spine. Additionally, in the synovial joints, we're going to have ligaments and tendons. Ligaments are attaching bone to bone, and tendons are transitioning muscle to bone and attaching them. Tendons are part of muscles, however, they function more like ligaments, and that means their consistency is more cartilaginous. It has a lot more collagen in it, and it's doesn't repair itself as good as muscle does, and it actually repairs itself and heals more like ligaments. So it really varies by joint. So we will get into that later. And then we also have bursas. They're these little sacs here. They're fluid-filled sacs with synovial fluid inside. And they basically are going to be in high friction areas where tendons are gliding over surfaces to allow smooth gliding. So you have one here right in front of the anterior to the patella, allowing that to glide over top of that where the tendon is embedded into the patella between that and the skin. Then you also have one here that's the infrapatellar bursa, which is just posterior to the patella tendon to allow that patella tendon to be able to glide when it's flexing. So every joint that we go to are going to have these types of structures, and it's going to vary joint by joint depending on how much we need in that, what's the function, how much stability we need. So it's just important to understand what these structures are right now so that you'll be able to understand it as we apply it later. And then now we're going to talk about joint stability and how those structures function to be able to create stability at each joint.